Good morning, everyone. Magandang umaga po sa ating lahat. Welcome to the 4th Environmental and Occupational Health Forum. I am Dr. Vivian Fe Fadrilan Camacho, Associate Professor. And on behalf of the Department of Environmental and Occupational Health, College of Public Health, University of the Philippines, Manila, we would like to thank everyone for joining us for this year's forum with the theme Building Back Better, Resilient EOH Systems for the Next Global Crisis. We are pleased to share this second virtual offering with all of you. To welcome everyone, let us listen to Dr. Carmencita D. Padilla, Chancellor of the University of the Philippines, Manila, for her message.
Dean Vicente Belisario and the CPH management team, public health workers, distinguished speakers, participants representing different agencies and groups, guests, a pleasant morning. Welcome to today's virtual forum that focuses on the challenges and opportunities to preserving and promoting environmental and occupational health amid the pandemic. Your participation in behalf of your respective institutions attests to the spirit and essence of collaboration that is vital to the success of this conference and attainment of its long-term goals. The theme, Building Back Better, Resilient EOH Systems for the Next Global Crisis, compels us to gather collective inputs and ideas, knowledge, and best practices from different perspectives like the academe, regulatory agencies, professional associations, and practitioners. And from this rich yield of wisdom and insights, construct a robust environmental and occupational health program, ready to tackle the next exigency in the country and beyond. We are honored to be graced by experts from different countries and organizations who will be joined by our very own specialists to talk about their responses to COVID-19 from the environmental and occupational health perspectives. The discussions and exchanges proved to be keys to the success of the third meeting held a year ago that also presented the initial COVID-19 responses in the Philippines and neighboring countries. For this fourth edition, the discourses will center on efforts to bring back resilient environmental and occupational health systems that were gravely affected by the pandemic. Rounding up this assembly are expert views on leadership and governance, financing, human resource, technologies, information management, service delivery, and the latest innovative interventions in environmental and occupational health. As always, we look forward to the active engagements of stakeholders in influencing environmental and occupational health policies, programs, and services, especially during the COVID-19 pandemic. Through this seminar, we hope to learn lessons from the variety of narratives that will be shared and discussed. I am heartened that the UP Manila is taking an active role in organizing this very consequential meeting that promises a brighter environmental and occupational outlook for the future with or without a crisis. Maraming salamat po.
Thank you very much, Chancellor Padilla, for your message. The Environmental and Occupational Health Forum was launched in 2018 through the efforts of the Department led by the then chair, Marian Fe Teresa Lumboy. The College of Public Health, which also serves as a Southeast Asian Ministers of Education organization, Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health, continues to support this annual gathering of stakeholders in environmental and occupational health. Now, let us listen to the Dean of the UP College of Public Health, Vicente Y. Belisario Jr., who concurrently serves as Over to you, Dean.
Thank you very much, Dr. Camacho. Can you hear me, Doc Bing?
Yes, we can hear you, Dean.
Thank you very much. And a pleasant morning to all. And my greetings and felicitations to our dignitaries, led by Chancellor Carmencita David Padilla. Thank you, ma'am, for gracing our occasion today. Undersecretary Maria Rosario Verger, and other dignitaries from our partner agencies, university and college regional center officials, Dr. Paul Michael Hernandez, the chair of the Department of Environmental and Occupational Health, as well as the faculty and staff of the UPCPH TropMed Philippines, esteemed resource persons, participants, ladies and gentlemen. On behalf of the faculty and staff of the College of Public Health, University of the Philippines, Manila, also designated as the CIMEO TropMed Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health, I warmly welcome all of you, dignitaries, resource persons, and participants to the 4th Environmental and Occupational Health Forum. The theme for this year's offering, Building Back Better, Resilient Environmental and Occupational Health Systems for the Next Global Crisis, is so fitting amidst the COVID pandemic that has challenged every one of us, no exception. The forum promises to be an excellent platform for a quick review of environmental and occupational health systems before and during the pandemic, using both local and international perspectives. Panel discussions will look into championing air quality improvement and climate change mitigation, as well as advocating for psychosocial wellness and COVID-19 vaccination in the workplaces and communities. Public health, environmental and occupational health systems and priorities, as well as programs and services, have all been adversely affected by the COVID-19 pandemic. Among the key environmental and occupational health interventions, like improving air quality in workplace and communities, promoting green initiatives with focus on the analysis of the system blocks, promoting psychosocial wellness, among others, the key interventions now include reducing COVID-19 morbidities through vaccinations. We will need to consider how we, in the environmental and occupational health community, as well as the larger public health community, together with all our partners and stakeholders, so many of them, so many of you, will need to prepare for the next global crisis through sustainable interventions, making use of the systems thinking approach, with major considerations for the 6 building blocks of the health system: leadership in governance, financing, human resource, technologies, information management, and last but not least, enhancing service delivery. We will also need to consider recalibration of our efforts for the achievement of the Sustainable Development Goals, while ensuring that inclusion, safety, resiliency, and sustainability can all be made possible in the new normal with much less COVID. As we move closer and closer to 2030, the end date for the SDGs, there is a need to continue to align our efforts so that we contribute even more towards achieving the Sustainable Development Goals amidst disruptions in the health services. All these in the spirit of enhanced partnership and collaboration. My commendations and very special thanks Now, these are all in order for the Department of Environmental and Occupational Health, one of the 7 departments of the UPCPH Simeo TropMed Philippines, for organizing this highly relevant forum. Special thanks to our resource persons, our partners, for sharing your valuable expertise and precious time in this knowledge sharing and learning exchange forum. We all look forward to stimulating and thought-provoking presentations, lively discussions in the next 2 days, as well as the resolutions and action points that will hopefully be collated by organizers and shared with all concerned, so that together we move towards achievement of our health-related SDGs. Wishing one and all a learning filled and very meaningful forum. Isang mapagpalang umaga po sa ating lahat. Over, Dr. Camacho.
Thank you very much, Dean Belisario, for your message. Now, to know more about the College of Public Health, let us watch a video developed by its communications unit. And that's our College of Public Health. Thank you once again to the UPCPH Communications Unit for introducing the college to our audience through the video. At this point, we would like to acknowledge our colleagues and friends who took time to join us this morning. We would like to acknowledge the presence, the Vice Chancellor for Administration of the University of the Philippines, Manila, Vice Chancellor Arlene Samaniego, our friends from the Philippine College of Occupational Medicine, Dr. Roberto Arturo del Prado III, and we have Supervising Health Program Officer from the Disease Prevention and Control Bureau, Department of Health, Engineer Maria Sonabel Anarna. Also from DOH, Medical Officer 4, Dr. Valeriano Timbang Jr. Also, we have Engineer Rene Timbang, and we have our former colleagues, former faculty. We have Dr. Eileen Benitez Timbang, Medical Officer, US Peace Corps, and Dr. Renato Joseph, Occupational Health Physician from the Speakers Bureau. Thank you very much for joining us this morning. At this point, we will have a photo op. We would like to request Dean Belisario and our speakers to turn on their cameras to document this monumental event. I would like to request our screen manager to guide our speakers when taking the photos.
Good morning, everyone. Kindly turn on your videos for the photo opportunity. Okay. On 3, please get ready. Okay, we'll wait for the others. Okay, on 3, 1, 2, 3, smile. Thank you very much. You may turn off your videos already. Thank you.
Thank you very much. Thank you very much, Dean Belisario, and to our speakers. You may now turn off your videos. At this point, participants are requested to post a selfie while attending this forum and use the hashtag 4th EOH Forum, hashtag Building Back Better, and hashtag WeAreCPH. We definitely value your feedback, so please accomplish the evaluation forms. The link for the Day 1 evaluation form will be shared by our staff later. For the audience live stream, to receive their certificates of attendance, please ensure that you accomplish the evaluation and the post-test. The link for the Day 2 evaluation form and the post-test will also be shared by our staff tomorrow. This will also be emailed to you immediately after the event. You are allowed to accomplish these forms until 3 p.m. of each day. So thank you very much again to everyone. I know all of us are already excited to listen to our distinguished speakers this morning. So let us now commence with our opening lectures. Environmental and occupational health systems before and during the pandemic, local and international perspectives. But first, I would like to introduce our moderator for this session. Dr. Paul Michael R. Hernandez is a graduate of BS Biology, cum laude, Doctor of Medicine, and Master of Occupational Health at the University of the Philippines. Dr. Hernandez is an Associate Professor of the Department of Environmental and Occupational Health, College of Public Health, UP Manila, and currently the Department Chair after serving as Chair in 2017 and CPH Assistant to the Dean for Planning and Development in 2016 to 20. Department of Health Sciences of the University of the Ryukyu, Okinawa, Japan. He was one of the recipients of the One UP Faculty Grant for Teaching and Public Service in Environmental and Occupational Health for 2016 to 2018 and 2019 to 21. Dr. Hernandez attended conferences, seminars, and training on occupational health industrial hygiene, emergency security, research ethics, and health leadership and governance. He is also involved in the conduct of courses for occupational health, environmental health, and public health. He participates in activities of key Philippine government institutions on occupational health and safety, like the Department of Health, Department of Labor and Employment, and the Civil Service Commission, the Commission on Higher Education, and the World Health Organization, Western. At this point, I would like to turn the floor to our moderator, Dr. Paul Michael Hernandez. Over to you, Dr. PM.
All right. Thank you, Dr. Dr. Vivian Fadrilan Camacho. Welcome to our opening lectures titled Environmental and Occupational Health Systems Before and During the Pandemic, Local and International Perspectives. An environmental and occupational health system can be likened to a health system with the 6 building blocks: governance, financing, information management, service delivery, human resource, and technologies. Among the 6, the most critical is governance, as this influences the rest of the blocks. Let us learn more of the EOH systems through our guest speakers. We would like to remind our speakers that they are given 20 minutes each to share their thoughts on this topic. Messages will be sent to them via Zoom chat box to remind them of their time remaining. We are privileged to have our first speaker, Dr. Mushtaq Ahmed Memon. Dr. Memon is working with the United Nations Environment Program as a regional coordinator for resource efficiency in Asia Pacific office located in Bangkok. He is supporting resource efficiency, sustainable consumption and production, green economy, green financing, sustainable public procurement, sustainable tourism, sustainable industries, and various areas for Asia and the Pacific. Dr. Memon is also project manager for the regional policy advocacy component of the EU-funded Switch Asia program to promote sustainable consumption and production and uptake of SDG 12 in Asia. Dr. Memon has a doctorate degree in environmental and resource economics from Hiroshima University in Japan, a master's degree in national development and project planning from University of Bradford in UK, a postgraduate diploma in transport from Karachi University, and Chartered Institute of Transport Bachelor's in Civil Engineering from Mehran University of Engineering and Technology, Jamshoro, and schooling at Cadet College Petaro in Pakistan. He has also published various papers in international journals and has delivered various training programs. Let us all listen to Dr. Mushtaq Ahmed Memon as he shares the experience of countries in terms of EOH systems before and during the pandemic. Over to you, Dr. Memon.
Thank you. Thank you very much. So without further delay, I would like to share my screen first. So, okay. So I hope my screen is visible and I am audible.
You're good, Dr. Memon. Thank you.
Okay, good. So now as we are in the, focusing on the public health and environment, and as you may, already know that one of the biggest challenges for the public health comes from the pollution, whether be the air pollution, whether be the wastewater, soil pollution, food pollution, and so on. So whatever the contamination or as an outcome of the pollution we get, that's where we have a public health issues. And just to make it more like in a focus, I today picked up the plastic pollution to talk about the public health challenges, but more important to bring you how you can support to achieve the sustainable development goals. And I believe every one of us by now know about those 17 SDGs that all the countries committed under the United Nations to achieve those by 2030. So we are basically in the decade of action, or the last few years, to achieve those goals. And when we got the COVID, we got in a much serious challenge. On the one hand, how we continue to support our systems, including the public health, because of the COVID. And number two, how do we really support the livelihoods and everything for the people? And that's where the UNEP had 4 building blocks, where I am leading on the global level, the first one, which is the medical and humanitarian emergency phase of the COVID, and including the healthcare waste. So I had like an intensive work on the hospital waste management, healthcare waste management, and including the COVID waste. But now coming back to the SDGs, as I mentioned that how the public health is related, or the occupational health is related with the SDGs, and how we all can contribute to that, to see that where we are in SDGs. As we know, by 2020, this is a SCAP report, a United Nations report. So that shows that we are far behind. And on the some of the SDGs, we are even regressing, especially life below water and life on the land. And that's, again, very much related with the public health and occupational health, as I will cite in the plastic pollution, that how the informal sector, the formal sector related with the waste management gets affected, their occupational health, and then also the fishermen, all the sectors in the marine environment, they get affected, and more important, all we consume seafood and so on. So looking back on the indicators under the each goal, we see so many either in the red or cannot be measured yet. So this is another challenge there. And here we see that how in the, especially as we are here for looking focus on the East and Northeast Asia, how the regressed, as I mentioned, the climate action, life below water, and stagnant, and so on. So when we look on the plastic waste before the COVID-19, and again, please visualize from the public health and occupational health point of view, that what is happening in our streets, even before the COVID, how the informal sector is engaged in collection of the plastic waste, how the plastic waste is choking our sewerage systems, bringing the flash floods, bringing a lot of dengue or waterborne diseases, malarias, and so on, because of the choked sewerage systems and so forth. So if you imagine that the severity or the impact of the plastic waste even before the COVID-19 was huge. And then, as I mentioned, that the microplastics in the waterways, in the sea, with the still the lot of medical research is going on that how microplastics are affecting us. But what is already there, that the plastics also carry the vectors, the bacteria, and so on, which can cause a lot of damage to the human health and so on. And so that's where we look on that, how much plastic we are really consuming every day. I mean, it's increasing enormously the way we are consuming, and even before COVID, and now with the lockdowns, with the home, like ordering the food and all this e-commerce and so on. And again, how we are disposing of that plastics. So you can just, because this is our daily life, so we can easily imagine how much like 30 years back the plastic was and how today is, and what it has contributed. Like it is supposed to be a very good material to protect us, rather increase our public health, to avoid the contamination of food and so on. But the way it is generated, the way it is disposed and managed, it's creating rather more damage than the good. So when pandemic arrived, how we see the masks, how we see the personal protective equipment, how we see the all the additional tubes and everything required in the medical, like healthcare and so on. And then more important, this healthcare waste, what I call, also move out of the hospitals, because many places quarantine at homes and so on. So it spreaded this healthcare waste everywhere beyond the hospital. So the collection, the management became much more difficult, and it also contaminated the normal waste. And then all the informal, formal sector got exposed to that. So this is like an additionality that came with the COVID in the plastic and so on. And as we saw, it has increasing multiple times in Singapore, in Thailand, in Philippines, especially in the food delivery systems, in the personal protective equipments and e-commerce and so on. And so that's where we have to really look back that how, even as a doctor, as a public health specialist, how we can help to address this plastic waste, which is coming because of pandemic, but also before the pandemic, and how it is happening. So the focus came on the circularity, that how we can really put our act together to help that we produce the important plastic is, as I mentioned, a very important part of all the our even the medical services, but how we consume that, use that, and how we dispose of that, how we recycle, how we destroy the like dangerous plastics and so on properly and so on. So that's where we look. And also to understand that the severity that middle income is increasing rapidly in Asia Pacific, like even in the Philippines, you may see that how much the mass consumerism and all this. So that means we have to really create a much, much bigger solution than just the pilots. That is very important to look on that. So the meaningful actions start with the how we really measure, how we monitor, how we plan, how we our policy strategies, innovation, solution, finance, and investment. Just to give you an example, that always we have a sort of a debate that when it comes to the national budgets, that whether to invest in the care or the cure, like health systems, or the care to avoid the pollution that creates a lot of public health and occupational health impacts. So this is where you have to be really a part of this discussions with the government and so on to really strategize that how much we can create the balance between the care and the cure. So this is very important to look when we talk about the plastic pollution and so on. And then as Philippines also one of the big countries, signatories to the many conventions and including the sustainable development goals and so on. So this is an advantage of bringing all those occupational health, public health requirements from the global treaties, from the national treaties and so on to address that. And that's where even as a doctor, I think is a lot really required on the awareness raising that you can contribute to your patients, your colleagues, and also to the greater like communities on the weekend and so on. And then there may be the guidance and the training on that. And then also, as I say, that we are moving very fast. The innovation, the startups, the youth is really key. So how the public health sector can really help a lot of startups for low carbon lifestyle challenge, addressing the pollution and so on. So that's where the messaging, as I mentioned, is very, very important, that how to ditch the disposables, including the mask and so on. So this is very important to create the proper messaging according to the culture norms, according to the people's desires and so on, how we address that. It depends on country to country, and you are best placed for that one to do that. So we have to bring the new consumer habits. We have to bring the improved products for the cleaning products and the practices, even in hospitals, the cleaning processes, and all this is very, very important, as we all know, to avoid the occupational health issues, even within the hospitals, and the greater public health issues from the waste generated out of the hospitals. So this is very important to really look on that side. And that's where I think the starting point, as we always say, the campaigns that works. So my really is, if out of this today's like a great event, if we can get some commitments on the campaigns as a doctors, you can really launch in Philippines, that will be really, really useful to look on the sustainable lifestyles that can address the occupational health and the public health and so on. And that's where the private sector. So it's not only about, let's say, the medical, our fraternity, but also the pharmaceuticals, also the government officials, the consumers, and so on, can come together to create the win-win situation together. So at the end of the day, what I would like to just emphasize that you should be the part of the legislative action by the governments. You should be the part of the budgetary action, as I mentioned, and you should be even the part of the oversight and action, including the monitoring and so on. So that's where I think we can really look forward to create these key areas of a healthcare waste management system, and also create the South-South cooperation within the cities in Philippines, but within ASEAN and within Asia. And that's where we can also bring a lot of us investments upstream and downstream to address the plastic pollution or air pollution and everything. Thank you very much.
All right. Thank you, Dr. Memon. I'd like to share an interesting fact to our audience this morning. Did you know that around 25% of the global burden of disease can be prevented by healthier environments? We could have saved a lot of resources if we reprogrammed our health services and created supportive environments. Let's go back to our opening lectures. Now we know how far EOH systems across countries with plastics as a case study. How about the Philippines? Allow me to introduce our next speaker, Dr. Maria Rosario Singh Vergere, OIC Undersecretary for the Public Health Services Team, Department of Health, Philippines. Dr. Singh Vergere is the current OIC Undersecretary for the Public Health Services Team and the official spokesperson of the Department of Health, Philippines. She was previously the OIC USEC for Health Regulation Team and Assistant Secretary in charge of the Public Health Services Team. She also acted as OIC Deputy Director General, Field Regulatory Operation, Food and Drug Administration, Office of the Director of the Health Facilities and Services Regulatory Bureau, and Chief of the Health Research Division of the Health Policy Development and Planning Bureau. Undersecretary Vergere has committed decades to public service, having worked in Marikina City's Health Office before joining the Department of Health in 2007. Aside from public service, she is also committed to nurturing our soon-to-be public health leaders, serving as faculty at the Development Academy of the Philippines and part-time faculty in Ateneo School of Government. She obtained her undergraduate degree in zoology from the University of Santo Tomas, her Doctor of Medicine degree from the De La Salle University College of Medicine, and her Master of Public Health from the University of the Philippines, Manila. Dr. Singh Vergere is unable to join us this morning as she has equally important engagements. Still, she sent a video presentation for us to appreciate the status of the Philippine EOH system before and during the pandemic. Let us all watch the video.
Good morning, everyone. I would like to thank the UP College of Public Health, led by the Dean of the College of Public Health, Dr. Vicente Y. Belisario, for inviting the Department of Health to this event, as it paves an avenue to share with everyone how the Department of Health, together with the local and national government, has supported environmental and occupational health even in this COVID-19 pandemic. The new decade started with a significant challenge across the globe. Currently, we are still facing the challenges of responding effectively to an ever-unraveling crisis with many unknowns, that is, the COVID-19 pandemic. Even before and during the pandemic, we are still determined to fulfill the objectives of our mandate, which are to increase access and prioritization for safely managed water supply and sanitation services, reduce the practice of open defecation, provide more accessible basic occupational health services for healthcare workers, and institutionalize poison control centers in all DOH hospitals by 2022. To meet these objectives, we have set strategies such as thorough reviews of and formulation of policies, capacity building, and established networks with our partners. in line with Administrative Order 2017-0007, guidelines in the provision of essential health service packages in emergencies and disasters, the WASH requirements of the general population are met primarily through the following components in accordance with the national and international standards: hygiene promotion, including hand washing, hand hygiene, water supply, excreta disposal, vector control, solid waste management, and drainage. Despite that much of their time was devoted to COVID-19 response for the community space disinfection, the sanitation inspectors at the local health units continue to provide WASH services, which include drinking water quality monitoring, inspection and regulation of food establishments, issuance of sanitary permits and health certificates, participation in vector control activities, toilet construction, managing disposal of COVID-19 deaths, and facilitated the management of vaccine waste, such as collection, transport, and disposal. Also, we continuously provide commodities for safe drinking water to prioritize local governments from households in 5th to 6th class municipalities using a level 1 water source. It has been more than a year since we have started this battle against the evolving COVID-19. Thousands had been infected and lives had been lost in the process. Up to this day, we are still learning about the different possible factors that could attribute to its transmission. Because of this, we have to be aware of these particular conditions that can be factored in from our environment. Let me share with you some environmental and occupational health programs and activities that relates with the pandemic. First, we have food safety and COVID-19. The Center for Disease Control and Prevention recommends thorough washing and disinfection of food purchased prior to handling. As much as food packages and food handlers have not been identified as a risk factor. The virus can persist on surfaces between a few hours to days. The process of preparing our meals play an important role in the spread of COVID-19. Food handlers should continue to follow our minimum public health standards in their workplaces. Good sanitary practices are advised when moving and preparing food. We should not forget washing our hands regularly, separating raw meat from other type of food, cooking at high temperatures, and storing unused food in the refrigerator. Besides the prevention of COVID-19, we should also be wary of other zoonotic diseases that can be transmitted through improper food handling. In addition, the WHO recommends the 5 keys to safer food. Keep it clean, separate raw from the cooked, cook thoroughly, keep food at safe temperatures, and use safe water and raw materials. Last October 15, the Philippines joined the global community in celebrating the Global Hand Washing Day. This global advocacy aimed to increase awareness and understanding about the importance of hand washing with soap as an easy, effective, and affordable way to prevent diseases like COVID-19. In the Philippines, the DOH, together with the Department of Education, WHO, and UNICEF, led the Global Advocacy Day dedicated to promoting awareness and understanding of the importance of hand washing with this year's theme, Malinis na Kamay para sa Kinabukasan ng Bayan. This featured good practices such as the use of behavioral nudges or simple cues and establishment of hand washing facilities. They support the school's initiatives on water, sanitation, and hygiene or WASH to ensure safe drinking water and the use of proper sanitation facilities. We know well that COVID-19 can be transmitted through acts such as sneezing, coughing, and talking to people in close ranges. We should be aware that areas with high levels of PM 2.5 or particular matter measured to be 2.5 microns or below and nitrogen dioxide were associated with increased viral infections. A study in Peru showed that 1 unit increase in PM 2.5 concentration was associated with a 9% increase in COVID-19 related fatality. It has been observed that there is a significant correlation between the levels of air quality and COVID-19 infection and mortality. We must pay close attention to our communities that are continuously exposed to indoor air pollution, which could contribute a greater risk of being infected with COVID-19, and in turn results in a wider transmission of the virus in the community. Our partner DNR has this new policy on PM 2.5 entitled Establishing the Breakpoints for PM 2.5 Air Quality Index that serves as a guide for the general public on the cautionary measures on different levels of air quality for PM 2.5. Temperature and humidity have a role in the mobility of the virus and may have effects on the transmission of COVID-19, as proven by a study done at Bangladesh. Regions with mean temperature between 7 degrees Celsius to 25 degrees Celsius per day have a higher number of cases and fatalities compared to regions with mean temperatures above 25 degrees Celsius per day. Their study noticed that there were increasing cases and fatalities at location with 65 to 80% mean relative humidity per day. This condition was seen to be optimum for the prolonged survival of the droplet nuclei in the environment. Proper waste management should be emphasized to avoid further spread of infection in a clinic or in a hospital setting or through any institutional, commercial, industrial establishments, community quarantine units, or any facilities with other similar healthcare services with activities or work processes that generate healthcare waste. Because of its wider scope, we need partners like the Department of Environment and Natural Resources and the Department of Interior and Local Government. Virus-contaminated healthcare waste could possibly infect workers in the waste management industry because of the direct handling and poor safety practices. Waste could be disinfected and properly segregated to provide better healthcare waste management. Temporary storage up to 9 days can also be done to prevent the spread of contaminated waste. There are unavoidable wastes brought about by the pandemic to protect ourselves from the virus, like the frequent use of face masks and infectious waste, not only from the health facilities, but even from our homes. As a result of this, we add load to the environment on waste generation. The Department of Health in this time of the pandemic has been faced with the challenge of the rapid surge of infectious waste in the demand for COVID-19 treatment and care that are generated in our healthcare facilities, in quarantine and isolation facilities, and even at homes. This is coupled with a surge of used face masks and PPEs from individuals in the practice of the minimum public health standards. The DOH issued policies to respond to this challenge. Some of these policies include Department Memorandum 2021-0031, or the interim guidelines on the management of healthcare waste generated from COVID-19 vaccination, and Department Circular number 2021-0439, or the operational guidelines on the reverse logistics of COVID-19 vaccines. While we have these issuances, other agencies like the Department of Environment and Natural Resources have already addressed this concern in view of environmental protection. In order to combat a specific form of infectious waste, the Department of Health has the Zero Open Defecation Program. Open defecation is a known practice of passing feces outside a latrine or toilet. Exposed fecal material can attribute to food and water contamination, which can result in higher incidence of diarrhea, cholera, worm infestations, hepatitis, and other related diseases among the community. Because of this, the Zero Open Defecation Program aims to contribute to the realization of the National Sustainable Sanitation Plan by eliminating the practice of open defecation. We are currently at 14,239, or 33.79% total zero open defecation barangays, and we aim to hit the target of 90 to 100% by 2023. Of climate change, environment, and health is a remarkable move. Definitely, the DOH is walking the talk as we in the DOH, together with the DNR, annually celebrate the integration of health and environment. recognizing the importance of having health and environment at the center of sustainable development, and to protect and advance the right of the Filipino people to a balanced and healthful ecology and the right to health, President Duterte signed Proclamation number 595, series of 2018, declaring every September 26 of every year as the World Environmental Health Day in the Philippines. For this year, the World Environmental Health Day, the theme is Kaligtasan at Kalusugan sa Kapaligiran, Bida sa Pagbangon ng Lipunan. In the intersectoral level, the DOH chairs the Interagency Committee on Health, the ISE, with the NR as vice chair and 10 members from concerned national agencies. This Interagency Committee on Health oversees the National Environmental Health Action Plan, or the NEHAP, of the sectoral thematic groups, namely water supply and sanitation, air, solid waste, chemical, food, occupational, and climate change. For sectoral groups, the collaboration and coordination of member groups in the sector are being addressed to have unified directions and synchronized actions. The NEHAP sets the national level direction on priority environmental health issues aligned with sustainable development goals, which all agencies adopt and adhere to. For climate change, the National Environmental Health Action Plan underscores the need to build adaptive capacities of women and men in their communities, increase the resilience of vulnerable sectors and the natural ecosystems to climate change, and optimize mitigation opportunities towards gender-responsive and rights-based sustainable development. With this, we do hope that we can work together in the attainment of this goal. Finally, on building climate-resilient health system, the Philippines, through the Department of Health and in collaboration with other national agencies like the DNR and the Climate Change Commission, is working on the requirements of the Green Climate Fund for the approval of a project entitled Strengthening Health Sector Resilience to Climate Change and Disasters in the Philippines, that aims for a climate-resilient environment, especially the most vulnerable sectors and communities. Health sector resiliency that includes infrastructure and health systems are the main elements of this proposal, as well as support to community resilience through technical assistance and local coordination and networking. With concerted efforts and sterling commitment to advance innovations, we can capably combat the effects of climate change even in the face of the COVID-19 pandemic. The Department of Health remains relentless in this pursuit, and our partnerships and linkages with stakeholders will continue, and together we can all do this. Weak implementation of policies and standards on occupational health and safety has always been an issue pre-pandemic. It took an unprecedented occurrence in the form of the pandemic for the duty bearers and the right holders to realize the importance and capacity in place in all establishments, whether large, medium, small, or micro enterprises. Things that were highlighted in this pandemic were the readiness of our systems to face disasters, emergencies, and pandemics, as well as the importance of medical and emergency action plans, including work arrangements and delivery of medical and health services to the people. The COVID-19 pandemic has catalyzed improvements in our financing and service delivery, exemplified in coverage for isolation, testing, and confinement, as well as the extensive provision of telemedicine to provide occupational health services in these challenging times. In terms of existing technologies in the field of health, the pandemic has highlighted the importance of the application of hazard control principles in the workplace. Biohazard control measures were advocated and PPEs were made available not only to our healthcare workers but to the community as well. It also has highlighted the heroism and sacrifice of each healthcare worker, from the doctors down to the utility workers and the important players behind occupational health and safety, our health and safety practitioners, industrial hygienists, safety officers, surveillance officers, and mental health professionals. And lastly, databases for occupational health remains to be a challenge, but this may be addressed through strengthened implementation on reportorial requirements as required by the law. This will be incorporated and supported in the implementation of the Universal Healthcare Law, wherein adult services for the working population will be offered. Overall, lessons learned from the experience would be used to further improve the system to protect all workers in all circumstances. In every difficult situation, there is an opportunity, and it could not have come at a better time for occupational health services and environmental health to shine and be recognized. This will be my last slide. As the COVID-19 pandemic continues to affect people and countries around the globe, we must continue to protect our environment and our occupational health because everything is interconnected. And with these steps that the government has undertaken, we hope to build back better our country and more resilient health systems. Maraming salamat po.
All right. Thank you again to our speakers, Dr. Memon and Dr. Singh Berhere, for enlightening us this morning in terms of environmental and occupational health systems, both locally and internationally. At this point, we can now accommodate questions relayed by the audience. Okay, Dr. Memon, we have a question from the audience. The question is, do we have any sustainable projects to deal with plastic pollution, like recycling and upcycling plastic products? All right. So I think Dr. Memon has been disconnected to this meeting. I'd like to request our experts from environmental health if they can provide any insights in terms of sustainable projects when dealing with plastic pollution.
Thank you so much, Doc PM. If I may respond to the question, please.
Go ahead, Dr. Vic Molina. Dr. Vic Molina is a professor of the department specializing in environmental health.
Okay, so thank you so much for that question. In the Philippines, we have Republic Act 9003, which sets the policy for recycling and upcycling of plastic waste. No? But in terms of projects, most of the best practices as far as recycling is concerned are really implemented by the local government units because as we all know, solid waste management is a devolved function where the local government is the major responsible for this concern. So if I may just mention best practices in the Philippines that you can look at, we have Teresa, now the municipality of Teresa and Rizal, and Los Baños, no, in Laguna. So the answer is yes. Now we have policies and we have existing projects in the Philippines. Thank you so much for that question.
Thank you, Doc Vic Molina. Okay, the next question is environmental and occupational health included already in the curriculum? Is environmental and occupational health included already in the curriculum? So, so this was a question raised through our YouTube live stream. Let me first answer that question. So, in terms of inclusion to the respective curricula, currently the department offers, well, the college offers the BS Public Health program, and it has courses on environmental and occupational health. We also offer, the department offers Master of Occupational Health and a Master of Science in Public Health, Environmental Health. That will be at the tertiary and the graduate level. As for for the high school, for the K-12 curriculum, we will try to verify if there indeed are courses specific to environmental and occupational health. I would like to believe that there are specific topics being discussed at the K to 12 program, but I don't think it will be it would be packaged as environmental and occupational health, but these will be distributed across the science classes of the high school students. So we have next question would be, can disinfected used gloves, face masks, and disposable PPEs be mixed with general waste? Can disinfected used gloves, face masks, and disposable PPEs be mixed with general wastes? Okay, so let me answer that question. Doc Vic, would you like to respond? You're muted, Doc.
Please proceed, Doc PM.
All right.
Yeah, thank you.
Thank you. So the question is, should these hazardous wastes be mixed with general waste? The answer is no. The answer is no. There should be specific waste management procedures for gloves, face masks, and disposable PPEs. We have a raised hand from one of our speakers, Mr. Ramon San Pascual.
Good morning, and thank you for this forum. To the last question about mixing the general waste with that of PPE, for example, coming up from hospital treating COVID. So yeah, the answer is no, not only for the safety reasons, but as well as for environmental reasons that plastics can no longer be recycled in any way and will just stay in our environment the moment it is disposed. And therefore, I think the first question should be answered on what sort of models and examples are being done. First, to avoid use of single-use plastic, even in the treatment of COVID, particularly as PPEs. And then secondly, for properly disposing them the moment they are used, because it's unavoidable after all. The best practices that we have in a green hospital network are those being done by one in Iloilo from the St. Paul Hospital, and others, and two other hospitals in Indonesia, wherein they're able to substitute disposable PPE gown with that of reusable. And it has been going on for more than a year now, which proved to be safe as well. But more than that, it is economically viable, because then they save millions in not having to spend for disposable PPE gowns and just to be thrown away after single use. And third, for the reason of environmental protection, and they can even calculate the carbon footprint that they are able to save simply because they did not resort to just using disposable PPE. So those are good models, we would say. And the solutions are from both sides of the spectrum in the operations of hospital. One, from the making decision on the procurement, and then the other is making a proper decision on the disposal. And I think we should continue working on this, but at the same time, do not be simply take belief in the false solutions being thrown out in the open now, whether they call it WTE or waste to energy, or they call it incineration, or they, and even recently we are arguing with the DNR on the policy that they adopted, qualifying certain hazardous materials from the hospitals as non-hazardous, and therefore can already be considered as feedstock to cement kiln or to help in energy production for cement manufacturing. We say no to that because in the end it's still incineration. It's still a form of what they call as waste to energy, and that it still destroys our environment and it harms people's health. So there's a lot of discussion to be made on the plastic crisis that come out from the pandemic. Thank you so much.
Thank you, Sir Mon, for that insightful information, particularly on plastics, with focus on the healthcare sector. So, so let's proceed with the next question. Okay, I got a direct message from one of the participants, Dr. Memon. This question is addressed to you. The question is, can you outline what the UN or other multilateral agencies or countries have been done on the Great Pacific Garbage Patch? Was there a move to reduce it at least? Requesting our staff to spotlight Dr. Memon's video, please.
Okay, thank you. Sorry, I couldn't unmute. So yeah. So basically, UN is an intergovernmental body. So the decisions in the UN are taken by the governments. As you may know that we have many treaties, and then some countries are party to the treaties, some countries may not opt to the party to the treaties, and so on. So now for the plastic pollution, including the bags, there's one treaty being negotiated by the governments. As I say, that is for the governments to decide to put in place. So which is not yet there, the treaty on the bags. But what UN does in the meantime, that we build the capacity, exchange the experiences of the countries who are putting the pressure to reduce the plastic bags through either the regulatory processes like banning, or through the standards like a thickness and so on for recycling, or through the economic instruments like putting a price tag on the plastic bags and so on. So we bring a lot of a capacity building on the experiences on how to, like other countries who have a successful stories, to bring that till the treaty in place. Once treaty in place, like a Basel Convention, which does not allow the illegal shipments of the waste, including the plastic waste, then on the one hand, we help the countries to monitor that they are like a part of the treaty, how they are doing for that. But number two, to build their capacity through trainings and so on, how to do the monitoring, how to improve the situation, including the recycling and so on. So basically, this is a two-way. So one is till the governments agree for any treaty, then we try to help the countries to implement the treaty. But before that, we bring a lot of good practices, trainings, and so on to improve the situation, help the countries to improve their situation. Thank you.
Thank you, Dr. Memon. So, Dr. Memon highlighted that the United Nations assists the concerned countries through providing technical advice and empowering them so that they can address their respective environmental and occupational health concerns on their own. So thank you, Dr. Memon, for that. Let's proceed with the next question. Okay. Doc Vic, I'm not sure if you can answer this question. This is a local concern. Or maybe Dr. Memon can add to the discussion. Since face shields are no longer used in most parts of the country, how do we move forward in terms of disposing these face shields? What can we do at the level of the community or LGU? Anyone would like to answer?
Sorry, it's for me or?
Apologies, Dr. Memon. I'll request Dr. Molina first if you'd like to share his thoughts, and then we'll proceed with your inputs.
Okay, thank you so much for that question. That's a very timely and very relevant question. With regard to face shield, I think one of the best approach is to consider reusing it. This is one approach that is aligned with waste minimization. Okay, because unlike the face mask, face shield can be reused. No, it can be cleaned after use. It can be disinfected at the household level. So if this will be observed, now we can actually reduce a lot of waste, no? Because I believe that unlike the face mask, face shields are reusable. So that's one. So I would like to
Right.
suggest, yeah. Thank you very much.
Thank you, Doc Vic. Dr. Memon, would you like to add to the discussion? How do we address or how do we dispose the face shields? What do we do with it? Since the Philippines already is no longer requiring wearing of face shields.
Okay, so I mean, as we all know, it's already many years, like DNR already put landfill taxes and so on to reduce the waste. So in this way, like under the extended producer responsibility, the producers, they have to create the full, like a closed loop collection systems, recycling or destroying if that's a hazardous waste. So I think for facials also, we have to look back to the producers, and producers that may not necessarily be the original producers. If they are imported, then the like importers or the retailers, they have the responsibility on that. But we have to create all the closed loops. So it's not only about the facial, but for any those, even like a pet bottles, like for soft drinks. So if we can create the closed loops where you have a take back systems, where you properly segregate and hand over back to the retailers or the producers, and it's their responsibility to take care of that. I think in that way, much faster, efficient way. Thank you.
Thank you, Dr. Memon. So, particularly for highlighting the closed loop system, that it is indeed the producers, the manufacturers, should be the one ensuring that wastes from their products be disposed or recovered accordingly. Thank you, Dr. Memon. At this point, I think we're down to one question because we're almost reaching our the time allotted for this Q&A session. Okay. So the question is, are there punitive actions when violating environmental health provisions? Are there punitive actions when there are violations in terms of environmental health provisions? I think this would be on the local setting. Doc Vic, would you like to answer the question?
Thank you so much, Doc PM, and thank you very much for that question. The answer is yes. No? All laws, whether it's local, national, or even regional laws, once it is approved and enacted by the government, there is always this clause. Now we call it as the penal provision of its law. So although the penalty may vary, no, depending on whether it's a local ordinance or a national law, no? But in general, the answer is yes. No? There are definite penalties, no, for environmental violations. Thank you very much.
Thank you, Doc Vic Molina, for that. So yes, as with any law or policy, there are penal provisions. So anyone violating the law would be penalized. The specifics would be based on the law. So at this point, all right. So with that, this concludes our open forum. So thank you everyone for the insightful questions, and thank you also to our speakers, Dr. Memon, and to our surprise resource person, Dr. Vic Molina, also equally able to address the questions of the audience.
Thank you.
Thank you.
Thank you very much.
Thank you. Bye-bye.
Dr. Memon, please stay on the meeting. We're going to award the certificates of appreciation.
Okay.
Thank you. So the certificate reads: College of Public Health, University of the Philippines, Manila, Semiotrop-Med Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health, awards the certificate of appreciation to, for his or her invaluable contribution by sharing his or her expertise as resource person for the 4th National Environmental and Occupational Health Forum conducted by the Department of Environmental and Occupational Health, done remotely from the College of Public Health, University of the Philippines, Manila, on November 25 to 26, 2021. Given this 25th day of November in the year 2021 in the city of Manila, Philippines. Signed, yours truly, Chair and Overall Coordinator, Dr. Fernando B. Garcia Jr., Assistant to the Dean for Planning and Development, and Dr. Vicente Y. Belisario Jr., Dean and Center Director. The College of Public Health, Simeo Trobment, Philippines, awards the Certificate of Appreciation to Dr. Mushtaq Ahmed Memon of United Nations Environment Program, Regional Office for Asia and the Pacific. Thank you again, Dr. Memon. The same certificate is being awarded to Dr. Maria Rosario Singh Vergere of the Philippine Department of Health. Thank you again to our excellent speakers. This concludes the opening lectures, Environmental and Occupational Health Systems Before and During the Pandemic, Local and International Perspectives. We will now have our wellness break. Our program resumes at 10:30 a.m. This has been your moderator, Dr. Paul Michael Hernandez.
Thank you.
Thank you, Doc.
Good morning once again. Our program will resume at 10:30 a.m. See you in a bit. Good morning again to everyone. Welcome back to the 4th Environmental and Occupational Health Forum. We would like to remind everyone to accomplish the evaluation form that will be shared by our staff later. For the audience here in Zoom or those watching our live stream, to receive their certificates of attendance, please ensure that you accomplish the evaluation forms for days 1 and 2 and the post-test. The link for the day 2 evaluation form and the post-test will be shared by our staff tomorrow. This will also be emailed to the participants immediately after the event. You are allowed to accomplish the forms until 3 p.m. of each day. Earlier, we listened to Doctors Memon and Singh Verhare. Let us now focus on two critical aspects of environmental and occupational health by moving to our panel discussion, championing air quality improvement and climate change mitigation. Allow me to introduce our second moderator for this morning. Professor Gayleen F. Manalang Jr. is a physical therapist and occupational health professional. Is again a physical therapist and an OH professional. Before joining the College of Public Health, she was an instructor of physical therapy at the College of Allied Medical Professions. As faculty of the university, most of Professor Manalang's extension and community service work had been with the Philippine Physical Therapy Association, or PPTA, the Institute of Aging of the UP Manila National Institutes of Health, and more recently, the Philippine Society of Geriatrics and Gerontology. Professor Manalang's main research pursuits are with PhilShift, interdisciplinary group from the University of the Philippines and the Ludwig Maximilians University Munich, whose collaboration aimed to study the Filipino chronotype, or the body clock, and shift work. PhilShift was a research program of the UP Center for Integrative and Development Studies that aimed to work with industry towards strategies that promote health, productivity, and sustainability of the local contact center workforce. Professor Manalang stood as principal investigator of the Philippine Chronotype and Social Jet Lag Survey, co-funded by the UPCIDS and Philippine Council for Health Research and Development. She started her this as her dissertation and researcher in the field of human chronobiology. Professor Manalang is recognized by the Professional Regulation Commission of the Philippines as the 2017 Most Outstanding Physical Therapy. In 2018, she was the lone recipient of a Researcher Links Travel Grant in the Philippine program of the British Council's Newton Fund. The grant enabled her to undertake a visiting researcher appointment at the section of chronobiology, University of Surrey, United Kingdom. At this point, I would like to turn over the virtual floor to our moderator, Professor Gayleen F. Manalang Jr. Over to you, Professor Manalang.
Thank you very much, Dr. Bing Fadrilan Camacho. Greetings to all and welcome to our panel discussion titled Championing Air Quality Improvement and Climate Change Mitigation. We would like to remind our resource persons for this panel discussion that they are given 20 minutes each to share their thoughts on their respective topics and that they will be provided or sent messages through the Zoom chat box, advising them of the time remaining for their presentation. Please join me in welcoming our first resource person, Attorney Glinda Batan-Baterina. Attorney Glinda Batan-Baterina is the Deputy Executive Director of Clean Air Asia. She is a lawyer with 20 years of experience in policy development for clean air, sustainable transport, and climate change mitigation. She helped draft the 1999 Philippine Clean Air Act implementing rules and regulations and led the Asia Clean Fuels and Vehicles Program, which resulted in cleaner fuels and vehicle policies and roadmaps for Vietnam and the Philippines. Attorney Batan-Baterina holds a Master's in Environmental Management degree from the Ateneo de Manila University and University of San Francisco, a Bachelor of Laws from the University of the Philippines, and a Bachelor of Science in Commerce, major in accounting from the University of San Carlos, also in the Philippines. Let us all listen to Attorney Batan-Baterina as she discusses initiatives on promoting good air quality in our communities.
Thank you very much, Professor Gayleen. Please allow me to share my screen now and to share with you some of the insights that I have gained after having worked 20 years on this issue of air pollution and climate change. So the topic that has been assigned to me today is ensuring good air quality in communities. And I'd like to start by just sharing a little bit about my organization, Clean Air Asia. We are a non-government organization registered here in the Philippines, but we were formed by the Asian Development Bank, USAID, and the World Bank in 2001. And our main programs are helping governments, national governments, and city governments in air quality and climate change programs, and also on sustainable transportation. Now, in 2018, Clean Air Asia looked at official air pollution level data from across 419 cities in the region. And what we found out was that when we compared these ambient, so outdoor particulate matter 2.5 concentrations in these cities where there are air quality monitoring equipment, more than 90% of these Asian cities are still at risk from the health impacts of exposure to PM 2.5. And why is that? If we look at this graph here, as you can see, almost all of the cities didn't meet the WHO air quality guideline, which at that time, the 2005 WHO air quality guidelines were at 10 micrograms per normal cubic meter. Now, as we know, in September 2021, WHO tightened the guideline further to 5 micrograms per normal cubic meter for PM 2.5. And so really, our populations are breathing air that aren't safe for their health. Now, just going back to the health impacts of air pollution, as you can see, it affects every part of the body. And so from the central nervous system, even to the cardiovascular system, of course, to our respiratory systems, even reproductive systems. And this doesn't, the impacts don't only result in illness, but they actually result in premature mortality. But I want to focus a little bit more on the new science that has been released on the impacts of air pollution on children, and even in infants that are still developing in their mother's wombs. As you can see here from WHO infographics, really the impact on children is quite significant. No, so even while they're in the womb, they're already impacted by the air pollution that is being breathed by their mothers, and that can affect them for life. It can mean stunted lung growth, impaired mental and motor development, low birth weight, and other diseases that can haunt them even into adulthood. And many more studies from the Health Effects Institute show that the burden of disease of air pollution is really here in our region. No? It is estimated by the WHO that about 7 million premature deaths occur annually. That is as of 2017 numbers. And most of those premature deaths occur in Asia. And as you can see here, the countries in Southeast Asia with the largest populations, the Philippines and Indonesia, bear the greatest burden. And it is not just outdoor air pollution that is affecting our populations, but it is also household air pollution from solid fuel combustion. As you know, we still have large populations in the region, particularly in South Asia, that still use biomass for cooking. And this is exposing women and children to high levels of air pollution indoors. So as you can see, this study again, and these graphs taken from the Health Effects Institute State of Global Air Report. This is the 2020 results. Ambient particulate matter 2.5 is responsible for 51% of deaths attributable to air pollution, and that is only in Southeast Asia. And household air pollution is almost the same percentage of the pie, that's 47%. And ozone, tropospheric ozone, accounts at the moment for only 2% of those deaths. But if you look at the map on the right-hand side, so the attributable deaths, depending on whether it's outdoor air pollution or ambient air pollution versus household, differs depending on the profile of the sources in the countries. So an estimated 500,000 deaths attributable to air pollution in Southeast Asia in 2019. And of that number, 3% of the deaths are newborn deaths. So going down to concrete examples on how communities, and my example here is a city that we are working with support from our partner 3M, Manila City. So what can a city do to really ensure good air quality? We propose, and we have been using the science-based approach to clean air action planning. And it's basically just two main steps. First, really identifying what are the sources of air pollution, what are the impacts of air pollution, and based on the science, what the science points to as the pollutants of concern and the sources of pollution in a community or a city or a country, identify the solutions, the mitigation measures to prevent and to control the air pollution. It sounds simple, but as we know, air pollution is complex because it comes from different sources. So it requires a lot of coordination and collaboration with different sectors. So to give an example of what we did in Manila City, before the beginning of the lockdowns in Metro Manila, we had put in micro air sensors. So typically, the Clean Air Act requires EPA reference grade monitors. So these are the most precise air quality monitors, and these are quite expensive. And so we understand that cities may not have the resources to put very many reference grade monitors. So we are augmenting the reference grade monitors that are run by the DANR with micro air sensors that are less expensive and can be deployed quite easily with minimal technical capacity at city level. So these are the results that we found before the lockdown, so February of 2020, and then up to February of 2021. No? So these air quality monitors, I think there were three to five of them we put in strategic locations in Manila City. One on roadsides and one I forget now exactly what the locations are, but we had three at that time. So as you can see, there was a significant drop from February to March up to April. So this was the real lockdown, where the activity really significantly reduced. But then when we started to ease the restrictions, we see that the levels of air pollution, so this is for PM 2.5, started to go back up to normal levels. And you can see the peak here, December of 2020. So this is important. So a city will know, what is the air pollution level. So here we see from the pre-ECQ, there it was at 40 micrograms per normal cubic meter of PM 2.5. And then it can go down. So what is feasible, you can go down to 10 and even lower than 10. Now, knowing the sources of air pollution, so this requires a lot of data collection. So what are the sources? We need to do traffic counts or use LTO registration numbers to know motor vehicle sources. And then not just looking at that at city level, but even going to the barangay level. So we did that. What are the emissions by district? So typically there are three types of sources: mobile or motor vehicles, point sources. These are industrial sources or stationary sources. Area sources include waste burning, construction dust, sources that you can't pinpoint a specific source to. So we need to know what are the sources of pollution, and the purpose of that is so we are able to target our limited resources to the sources that to the most important sources. We wanted also to look at what is the health impact. I mean, what is the health situation of the population in Manila City? Now, because it was we are still in a pandemic, it was very difficult to go household to household to gather this data. So what we did was we used proxy data. We looked at the PhilHealth claims in Manila, and then find what were the most number of reasons for the PhilHealth claims. And what we found out here in this graph is that the claims were mostly for respiratory and cerebrovascular causes. So really improving the air quality in the city can contribute to improving the health of the citizens. So based on all of the data that we found, then we have the Hinga Maynila Task Force. You need to have a home, like an institution within the city that is going to champion this. So the Hinga Maynila Task Force came up with these potential mitigation measures, no, for point sources, for area sources, and then for motor vehicles. And then even outside of that, the energy may, power generation or electricity may be generated outside of the city, but then the consumption of the people in Manila will determine, of course, how much electricity needs to be produced by a coal-fired power plant outside of Manila. So we need to look at that as an impact of running a city as well. So now we need to convince policymakers that if you take certain measures, it's going to help you achieve your health goals and your environmental goals. And the best way to do this is to do some modeling. There are actually available modeling tools to do that. So for this, in this case, we used a widely globally used model by the Stockholm Environment Institute called the LEAP IDC. So it's an integrated benefits calculator. So just very quickly, we looked at these scenarios. Okay, we said motor vehicles are a key source. So what if 100% of the vehicles really become Euro 4? No, so these are cleaner than pre-Euro or Euro 2. By 2030. What would that mean in terms of health impact? What if, let's say, because the waste burning was an issue as well, what if we reduce methane reduction from the landfill by having good waste management practices? We wanted to know how would that impact health, etc. So we had these solutions, and then we estimated using the model. We ran the model, and this was what we found. So these are then the emissions reduction. So emissions reduction compared to a business as usual in 2030 scenario. For particulate matter and NOx, ensuring that Euro 4 vehicles, that vehicles become all Euro 4 appeared to really get us about close to 80% and 50% reduction for PM and NOx. And for methane emissions, ensuring better waste management would bring us the highest emissions reduction. So these kinds of estimates, we can then, provide the mayor and the city council that, if you do this, you are going to see some very good benefits. But then we then looked at what would this mean in terms of concentration, because isn't it our goal is to reach the WHO air quality guideline? So so we plotted that here, the population weighted annual PM 2.5 concentration. If we would go with the business as usual scenario, we would just keep on going up and up and up here, to about 40 micrograms per normal cubic meter, way above the WHO guideline value. But if all the measures are implemented, our estimate is that the population weighted annual PM 2.5 concentration could go gradually down to 2 micrograms per normal cubic meter in 2030, achieving the WHO annual guideline. So then we go down into a little bit more detail. So, okay, how many avoided ALRI, how many avoided COPD cases, ischemic heart disease, lung cancer, strokes can you avoid? And the model is able to give you these numbers, which can be pretty convincing, because you can also then convert this into in economic terms, like the dollar or a peso value of the savings from your health system by just cleaning the air. So economic benefits here from avoided deaths is approximately this 6 billion US dollars in 2030, and within a 10-year period, about 32 billion. So the solutions, there are many solutions, and they many examples, which I will not go through here with you, but as you can see, many of these have been seen to have been successful in other cities. Of course, no, cities have different capacity, so we need to build their capacity so that even beyond the project, they really gets institutionalized and they own the systems that you put in place. So a lot of training being done in Manila City. So these are some interesting, so we had put micro air sensors. You see here, this additional two that we had put this year. And we are always wanting to understand more about the relationship. So what's the relationship between indoor and outdoor air quality? So we put an air sensor in the Fabella Memorial Hospital, and hopefully by next year we'll have enough results to say to see if there is a relationship. We need to engage several sectors. The youth here, we have a targeted campaign for them. Partnerships with academia, because we don't really have a lot of capacity at the city level, and their environment office is doing a lot of things, not just air pollution. So you see here, we have partnered with you, of course, UP Manila Department of Environment and Occupational Health, etc., with the Airshed Governing Board, with the EMB, the private sector. We are working even at the community level. Barangay 128, we're working with them to have a localized, community level action plan. Their problem is waste management and waste burning. So we partner with the community groups that are working there. My last slide and my final thoughts. Cities and municipalities, they are at the front lines of our fight against air pollution and climate change. We need to provide strong science-based clean air action planning in local governments, because we know this can result in multiple benefits: clean air, safe climate, better health, and a more productive society. We need to bring all the sectors together. The academia plays a very important role. I would challenge the academia to please do more studies so that we can, we have to have more studies on health impacts of air pollution, solutions to air pollution. No, I'm not seeing enough. Private sector, NGOs, youth, the vulnerable and the marginalized sectors, they play a key role, but they're often left out in the planning and in the implementation. So thank you very much for this opportunity. Please, please, please let us all work urgently to meet the 2030 goal, the target that the WHO has set for all of us, cities and countries, to achieve the air quality guidelines. Back to you, Professor Galen.
Daghang salamat, Attorney Baterina. Thank you for your presentation. We're monitoring our channels for questions about what you have presented, but so far none forthcoming. We'd like to thank you again for explaining not only about what good air quality means and how it can be achieved in our communities, but also the new science, okay? The new science on clean air, human activity, and also the human health connections. Okay, so it's a very interesting presentation. I would like to express everybody's appreciation over the data that you summarized in your slides. The data is not easy to come by. So the current situation has made everybody basically conscious of how clean air is really essential to life. We should not forget that even in our contemporary times, the main source of indoor air pollution is still that the fact that we are using biomass and wood burners, particularly in Asia. Okay. So we have this opportunity right now, even in the pandemic, to raise awareness in addressing clean air concerns and push for clean air action. Thank you again. We will now proceed to our next presentation on how the healthcare sector promotes green initiatives. Our next speaker is Mr. Ramon San Pascual. Mr. Ramon D. San Pascual is the Executive Director of Healthcare Without Harm, Southeast Asia. As a population, health, and environmental policy advocate, Mr. San Pascual brings with him years of experience in working with civil society organizations who are engaged in social development work, and he has dedicated many years on policy development, advocacy, and work with policymakers and stakeholders on population, health, environment, and sustainable development. Having worked with an extensive network of parliamentarians, health professionals, community and civil society leaders, Mr. San Pascual has helped form and strengthen coalitions of advocates upholding health and social justice in the Philippines and across the Asia Pacific region. He has served in executive positions of the Asian Forum of Parliamentarians on Population and Development, the Philippine Legislators Committee on Population and Development, and until recently, the Legislative Liaison Division of the Philippine Department of Health as its division head. Mr. San Pascual is a Bachelor of Political Economics graduate from the Polytechnic University of the Philippines. He obtained his master's in public health at the University of Washington in the United States. He also completed a certificate program in international health alongside his Master of Public Health degree. In 2004, he also completed the Population Leadership Program in the same university as a Gates Packard International Fellow. You may proceed with your presentation, Mr. San Pascual.
Good morning, everyone. Thank you for this opportunity of taking part in the environmental health forum taking place this morning. we missed the face-to-face annual conference that we used to do, but still, hopefully this is the last year that we're doing this online. But for this particular forum, I'm asked to talk about green initiatives for the healthcare sector. And I would take advantage of the time that is given to me to talk about not only greening, but as well as climate action that healthcare institutions and the sector can take up. So let me first talk about healthcare without harm and, and the network that we are managing on Global Green and Healthy Hospitals, which is a worldwide community of hospitals, systems, and organizations that are meant to promote not only public health or population health, but as well as to reduce the ecological footprint of healthcare operations, at the same time promoting environmental and public health in their respective communities. And this is a network that is spread out across the globe, present in 72 countries with over 1,500 members. And you would see there how we are present in Southeast Asia, the Office of Healthcare Without Harm that I am managing, and we are based here in Manila, and we operate in at least 8 or 9 countries in Southeast and East Asia, promoting green hospitals, climate action, and sustainable operations in healthcare facilities. Now, we may have read the recent COP26 resolutions that was just concluded a week ago. Now, healthcare has been central in this particular conference held in Glasgow. And this is in the recognition that indeed the climate crisis is part and fully can be appreciated as a public health crisis as well. We are impacted by climate as a sector, but we also contribute in the worsening climate condition. In fact, our emission as an industry, as a sector, is equivalent to 4.4 of global net emissions. And therefore, if we are considered as a country, the healthcare industry, we will be the fifth largest climate polluter on the planet. We are in the top 5 of the biggest polluters in the planet. Now, this is a familiar illustration to you of what are the health impacts of climate. So what we've been trying to do as Healthcare Without Harm is first, we try to estimate how much emission do we contribute, and therefore how much responsibility do we take, and how much more leadership can we exert to address degrading climate. And that study on the emission of healthcare came out just before the pandemic in 2019. Last year, as a follow-up, Healthcare Without Harm produced a global roadmap for healthcare decarbonization. It is the first ever attempt to chart a course to zero emissions emanating or initiated by the healthcare sector. It is intended as a navigational tool for achieving decarbonization and promoting resilience, and as well promoting health equity. The roadmap identifies how healthcare decarbonization, resilience, and pandemic preparedness can be mutually reinforcing and synergistic. We acknowledge that as in the Philippines and in Southeast Asia, we are among the most vulnerable of countries in the world in terms of climate events. That the biggest need and the biggest role that healthcare can play is to build resilience. However, as we pursue resilience, we should also be aware that the biggest war in addressing climate is to decarbonize the world across all sectors, across all economic industries. And healthcare is a big part of that. And therefore, the roadmap identifies how healthcare can take up actions in an organized, systematic manner to both address resilience and decarbonization or lowering of emission. First, what are the messages here? First, that the health sector needs to exert its leadership to take on the climate crisis. And we are a powerful sector enough to influence big policies. Second, that healthcare must chart a course to zero emissions, as promised way back in 2015 and as pursued in the recent COP in Glasgow. Third, to get there, it requires major transformation, not only blah, 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 but actual hard work being done at facility level. That healthcare sector, the hospitals, can be transformative and can be a leading agent on addressing carbon emission and decreasing emissions. So these are the three messages. What are the ways to address for healthcare sector the different challenges in terms of climate and emissions within hospitals? And what can be the impact in the trajectory towards 2050 net zero target? We cannot afford business as usual, as we all know. Therefore, we need to align ourselves with the different countries, with the different sectors, that climate commitment and emission reduction can be wrapped up. And therefore, there are healthcare decarbonization opportunities offered by the three pathways and 7 actions that are found in the roadmap I mentioned a while ago. And let me go to those 7 climate actions. Part 1 for healthcare, to decarbonize healthcare delivery facilities and operations. And I would say this is the heart of the roadmap wherein we can take part, whether as a doctor, as a nurse, as hospital staff, as hospital administrators, as Ministry of Health, or even as a regular patient and visitor to the hospital facilities. This roadmap, it highlights the 3 pathways and 7 high-impact actions. And the first pathway is what the health sector needs to do within its own operations, the clinical services and facilities, for instance, through practice, the way buildings are designed and used, and through waste segregation. The second pathway, the green in this chart, is what the supply chain can do. So if the first one is on the daily operations, the second one is on the supply chain within the hospital, making sure that healthcare products are zero carbon. It is not an easy challenge, but it can be done, and it is being done in many healthcare facilities now in more advanced countries, such as in the US, in Canada, in Europe, and even in Latin America. But there are commitments made by hospitals here in Southeast Asia that they will join the decarbonization roadmap and the road to and the race to zero, that as we call it. Now, the third pathway, which is I think the pale color here, is to make sure that the wider economy and society match the same pace of reductions across agriculture, the energy, transport, and housing infrastructure. We can no longer isolate ourselves and just be busy on clinical practices. We should align ourselves such that we are able to reduce the very disruptive impact of climate change if we don't do anything between now until 2030, 2030 until 2050. Now, the first action, and let me just talk about the pathways, so you can also imagine what can it take and what can hospitals actually do. The first action relates to the renewables of the energy sector. This is the cornerstone action of the wider energy transition that is meant to bring energy to health facilities and communities who do not have sufficient access now. And therefore, the way to do it is by healthcare cannot be provided, the services, without sustainable energy supply. And the way to do that is by renewable. Second is on buildings, which contribute 17.8 gigatons of emissions in biggest countries. Buildings here, I'm talking about healthcare facilities and infrastructure. Developing sustainable zero-emission buildings that are fit for purpose for healthcare in the 21st century is a cornerstone action in the way that they are being used and designed, the way they are built and materials used, as well as the wider infrastructure they rely on. In 2019, the Department of Health, with the assistance from various other stakeholders, including support from the ADB, and us in Healthcare Without Harm was part of the consulting team. The Department of Health came out with a 20-year health facility development investment plan that begins in 2020 onward. And part of that 20-year investment plan on building and renewing hospitals is to make it resilient, climate smart, and green. And among the components that they are able to elaborate in that plan is on how to build new infrastructure and buildings that are resilient and climate smart. And this is part of this action on number 2. Now, the number 3 includes travel, and in the whether in the US or in the Philippines. and soon we will be traveling again because of the improvement in the situation of COVID-19 and the acceleration of the pace of vaccination. Hopefully will not go the way where Europe is now, and we will be able to sustain the good outlook in managing COVID, that we can already open up next year our economy and therefore meet person to person, but that also would require travel. So that number 3 is, and I think the previous the presenter, our good friend Glinda, talks about addressing air pollution, and this is where travel would be a big part of managing and improving active and sustainable travel. The number 4 is on food. Again, these are the 7 high impact actions to reduce our emission in healthcare system. Food that is local, sustainable, and plant forward can ensure a contribution of close to 1 gigaton equivalent of reduction of emission. The number 5 is on pharmaceuticals. And then the number 6 is on the circularity of healthcare and sustainable healthcare waste management. And then less people that need hospital care means less emission. What does it mean therefore? This is the number 7. Establish greater health system effectiveness, health promotion, good hygiene, good rest, such that people need not even go to the facilities. And it contributes big in terms of emission reduction. Healthy population, healthy environment, therefore, is also healthy for our planet. Now, in the COP26, in the recent meeting of big leaders in Glasgow, there are only 2 sets of commitments being asked from healthcare leaders globally. Those that both came in person and those that participated online. And we are happy that at least 54 countries have already made commitment on both commitment area 1 and commitment area 2 as shown in the slide. The commitment area 1 is for the ministries of health and healthcare systems to address climate resilience. And this can be done by both conduct of climate change and health vulnerability and adaptation assessment at the system level, population level, healthcare facility, and this initiated by Ministries of Health, in our case by the Department of Health. Such an assessment must yield the National Adaptation Plan, and we're still engaging the Department of Health to be more focused on this, not only on the NEHAP as earlier presented in the first panel, and then therefore to raise fund. And I was glad to hear that the Department of Health's trust now is to tap the global environmental facility, and hopefully with all our help they would succeed and therefore strengthen our commitment on area 1 on promoting resilient healthcare systems. But commitment area 2 is also important to reduce again the carbon emission from the healthcare system. And in the recent COP, as you would see in the logo here, it was a collaboration between the Climate Change Conference of the UK government, the World Health Organization, and us in Healthcare Without Harm has been partnering with these 2 institutions during the entire COP26. And now the challenge is to sustain the momentum of the commitments made by 50+ countries and several healthcare systems. Now, I started with the Green Hospital. And when I presented the climate condition, what we are saying in Healthcare Without Harm is that to promote these 10 sustainability agenda goals of the Global Green and Healthy Hospital, whether on leadership, chemicals, energy, transportation, water, food, buildings, and purchasing, we must link up all our sustainability initiatives to climate action. We can no longer distinguish our own greening initiatives inside the hospitals from the challenge of addressing and reducing our emission. Now, I cited this in the open forum a while ago, that there are already several practices and models that we can make use of. For example, in properly managing healthcare waste by reduction, treatment, and safe disposal. And the hospitals here are one from Indonesia and one from Iloilo. There are also hospitals in the Philippines and Southeast Asia that are already into implementation of energy efficiency and utilizing renewable energy, and therefore reducing the carbon emission, saving costs on the hospital, and providing greater and efficient access to services, simply because the power is sustainable. And this is a model or a practice from the Philippine Heart Center and one from Taiwan. The Green Hospital model is found, as we know it, it's across Southeast Asia, but the best that we can cite was the host of the 2019 Green Hospital Asia Conference, the Kotek Wat Hospital in Singapore. From the building to the operations to the daily behavior of its people, they already invite the Green Hospital culture. The rooftop garden produces vegetables meant for their cafeteria consumption, as well as the excess harvest is also being sold to the public in the immediate community around the hospital. Transportation, purchasing, and then water management. These are all important interventions in a well-rounded green hospital operations. That in the end, if you're able to track down how much emission is reduced, then you would see that this hospital is not only green, but also resilient and climate smart. Pharmaceutical is a big component of the carbon emission because of the supply chain constitutes 70% of the carbon emission of any healthcare facility. And therefore, production in pharmaceutical and managing its transport and distribution and disposal of waste from the pharmaceutical is an important element in promoting sustainability in healthcare. Making use of sustainable chemicals and substitution of harmful chemicals, and this is very relevant in our experiences in the pandemic, is also an important sustainability action. And then food. This is special in Southeast Asia because our culture is strengthened by the food that we share in our community, in our offices, in our homes. But so true as well in green hospitals to serve sustainable grown food, fostering healthy eating habits, helping local communities, as well as enhancing healing among patients. So I would stop there. The rest of it are the tools that we can provide to different hospitals. And maybe we can discuss this in the course of the open forum. Enough to say that we don't only do advocacy, but we help hospitals raise awareness among their colleagues, even promote particular policies up to the level of the Ministry of Health, the Department of Health, the DNR, and the Climate Change Commission or our legislation. Capacity building and networking. We will have our next Green Hospital Asia Conference live in person, hopefully in 2022. We set it aside in 2021 due to the pandemic. The last one was in 2019. This is a big conference of green hospitals in our region. It will happen in 2022 in India, and we are extending our invitation to you. And our colleagues, our secretariat are busy already preparing for that, including the pre-conference that will happen next week online. So I'll stop at that, and I'll turn it over to our professor moderator for questions and answers. Thank you.
Our appreciation, Mr. San Pascual, on your presentation. Very early in your presentation, you mentioned something that is quite alarming. I have heard of this some time back, but perhaps for a lot of our participants, it was the first time for them to be hearing that our country, the Philippines, is regrettably poised to be the fifth greatest nation polluter. And I believe all in this forum, especially those in the healthcare sector that you have highlighted, would really want to contribute to measures to steer the country away from this negative distinction. So I just mentioned the three pathways that you outlined early in your presentation and which are clearly illustrated in the examples that you gave later on. First, that these of the three pathways is decarbonizing healthcare facilities and its daily operations. Second, decarbonizing the supply chain of these facilities. And lastly, since everything should be approached in a systems way, it should be a systematic approach, the acceleration of decarbonization in the wider economy and society. Okay. So thank you to our speakers for this panel discussion, Attorney Batan Baterina and Mr. San Pascual, for their great presentations. In the interest of time, we will limit the number of questions for our panel discussion. We are processing questions not only from the Zoom chat, but also through the that was sent through the YouTube channel through which we were live streaming this. Okay, so there were questions directly addressed to Attorney Batan Baterina, and some were relayed for Mr. San Pascual. So let me see. Okay, ahead of time, apologies for those who have sent questions, but which we will not be able to entertain. I will try to compress or put together some of the questions so that they can all be answered. Okay. For first, ladies first, for Attorney Batan Baterina. Ma'am, as I mentioned earlier, interesting data that you presented supporting what we say is the new science of our understanding of clean air. There's a question, ma'am, that was relayed to us privately, asking about data on air quality improvement, particularly during the period of lockdown in Manila last year. So period of March to August was mentioned. So I believe our participant wanted to consult you about how this data could be, how could this data be found, and what were the monitoring measures that were used to arrive at the data.
Thank you so much for this. I'll quickly answer the question. So for Manila City, we have the information. It is with the Department of, I forget, they have, I think, Department of Public Services. And the information was also communicated through the Manila Facebook page, and in the form of understandable infographics, actually in the local language, no, in Filipino. In terms of the raw data, so that is with the Department of Public Services because they are our partner. And I think access to this data should be coursed through via a request to them. But if you would like to have not just Manila City information, air quality information, then the UP IESM, that is the Institute for Environmental Studies and Management, Environmental Science and Management, is running together with the Rotary Club of Makati several air quality monitoring stations in several cities in Metro Manila. And I think you can access the information on a website called airtoday.ph. I hope it is still up and running. And these use reference grade monitors, GRIM instruments, and they were able to track also the ambient air pollution levels before the pandemic, they have been running for several years, and during the lockdowns, and up to now. So that's another source of information. Probably the EMB, NCR, and the EMB central office would have the information for the air quality monitoring stations that they are running all over the country. So I think that's the information. So you need to, when you use this data, be sure to know what was the instrument that was used, whether it was a reference grade monitor. These meet the highest of standards versus a micro air sensor. So for Clean Air Asia, we use the low cost sensors, and what we do, because there is a tendency for micro air sensors to exhibit higher readings. So there is a scientific way of calibrating these readings by co-locating them with a reference grade instrument, which we have done. And then the correction factor that you find, you apply that to the readings from the micro air sensors to get a more precise number. So this is important, especially if you're using this for a research paper.
Thank you, ma'am. Very detailed way of accessing the data, and also how to appraise the quality of the data, perhaps with reference to what you would like to do with the data. Looking again at our list of questions, let's make time for one for Mr. San Pascual. And the query is about calculating environmental footprints, sir. So they are inquiring how they can capacitate themselves to have this competence. Could you please direct our audience about trainings for this, estimating environmental footprints?
Yeah, we just launched 3 months ago what we call as healthcare checkup, which is an emission tool, emission measurement tool for hospitals around use of energy, waste output in the hospitals, and procurement. And we've done in Southeast Asia, we have done 2 trainings so far in hospitals. There is already an adoption of the tools by at least 6 of them that are running it in their healthcare facilities. It is an online tool that is global, being utilized intently in Latin America, certain parts of Europe, and just introduced some 2 months ago here in Southeast Asia, and certain Philippine hospitals have already adopted the tools. And this is on top of what we already launched much earlier as part of our climate challenge tool, as part of the services we render to the members of Green Hospital, or the Global Green and Healthy Hospital Network. So any further services that you can access us through my email, and I think I can provide it here in the chat, and also through our website. And certainly we can hold forums, trainings, and follow-up consultations on how to capacitate hospitals on reducing their emission by actual measurement on several operational dimensions of the hospitals. Thank you.
Thank you, sir. A lot of the other questions that we have pertain to specific measures for clean air, for also managing our facilities towards turning them into green facilities. Perhaps I will just attempt to capture everything in one question and inquire, perhaps a very down-to-earth, in a down-to-earth manner. Could you please provide us with, very quickly, provide us with starting points in terms of regulatory policies, particular to the Philippine context, so that, and for healthcare facilities at that, that would pave the way for institutions to really go into measures for promoting clean air and also for promoting green hospitals. Okay, so just maybe po an enumeration, okay, of immediate our policies instruments that come to mind. First, with Attorney Batan Baterina.
Thank you. Okay, specific to healthcare facilities. So I'm imagining some key environmental impacts. So let's look at the quality of air. I think that because we now know there is robust science showing the impact of particulate matter and specific air pollutants on health, then therefore I think we should endeavor to at least measure the levels of air pollution within our healthcare facilities, if that is possible, and to ensure that these meet the health standards. Second is on the disposal of the healthcare facility materials, that these are, of course, special waste that require special disposal facilities. So we should really ensure that these are disposed properly, and strict implementation of our existing laws relating to management and disposal of these, so that they are not burned, for example, or disposed illegally in waste in water bodies, or even in improper ways. I think because motor vehicles is often used in our operations, that we should ensure we have the cleanest vehicles. So at least Euro 4, and if we can shift to more electric, zero emissions transportation, those would be ideal. I think those are the ones that I can if we are able to shift to renewable energy in our facilities, if we have the option to have rooftop solar, so that we don't put an additional burden on our existing grid, which is really run 50% or more by coal-fired power plants, then being more decentralized in energy production, I think that also would be very ideal.
Thank you, ma'am. Mr. San Pascual.
Can you repeat the question, please?
Okay, this is attempting to capture multiple questions. It's basically inquiring after policies for health facilities so that they can pursue being more environmentally friendly. And in your particular scope in this forum, perhaps could you please guide us in the enumeration
Sure.
of these policies for green hospitals, for example?
Yeah, first of all, in collaboration with the work on air quality being as discussed by colleague Linda, we are also supporting that by installing air quality monitors in some pilot hospitals, particularly those that are nearby where coal facilities do exist in certain communities. And one of those hospitals is the St. Paul in Iloilo. By tracking the air quality in the community, they're able to educate not only the patients, but the surrounding barangays and also the LGU on what can be the harm that is posed by the presence of coal plant, and what can be done in terms of managing the health of the people and reducing the pollutant effect on the air among the public in those surrounding municipalities. That's one. Secondly, we are working with the Department of Health over the past almost more than a year now in terms of addressing healthcare waste during the time of the pandemic. And now that the pandemic has been waning and we hope to sustain that, we are also reviewing the policies that have been adopted in addressing plastics, volume of healthcare waste used up by the hospitals as well as by the communities for their protection. And by so doing, we will be able to help both national hospitals and those managed by the local government units. And one of that is the Pasig City, to move forward and approach healthcare waste management in a more sensible and sustainable fashion emerging from the pandemic. So this is a collaborative undertaking between certain LGU, the Department of Health, certain hospitals like the Tala Hospital in Caloocan, and then the UNDP. There's much more that we could share, but I just also shared the website that we have. So we can facilitate sharing of experiences and initiatives and policies across green hospitals, not only in Southeast Asia, but in the globe. Thank you.
Much appreciation for your answers, ma'am and sir. Okay. On behalf of all that are present at this forum, I would like to express our thanks to you by awarding certificates of appreciation as we conclude the first panel discussion of this forum. Okay. Our certificate from the College of Public Health, University of the Philippines, Manila, Simeo TropMed Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health awards this certificate of appreciation to our resource persons for their invaluable contribution by sharing their expertise as resource persons in the 4th National Environmental and Occupational Health Forum conducted by the Department of Environmental and Occupational Health remotely from CPH, UP Manila on November 25 and 26. Okay, this certificate is awarded today, okay, and signed by Dr. Paul Michael Hernandez, our chair and overall EOH Forum Coordinator, Dr. Fernando Garcia Jr., Assistant to the Dean for Planning and Development, and Dr. Vicente Belisario Jr., Dean and Center Director. The College of Public Health awards the Certificate of Appreciation to Attorney Glinda Batan-Baterina of Clean Air Asia. And also, okay, we award the certificate to Mr. Ramon San Pascual of Healthcare Without Harm, Southeast Asia. Okay. Thank you very much, okay, to you, our very excellent speakers, and to everybody for actively participating in this panel discussion through the Zoom chat, as well as the other channels where we are live streaming our EOH forum. This concludes our first panel discussion in this gathering, championing air quality improvement and climate change mitigation. I would like to return the virtual floor to our Master of Ceremonies, Dr. Bing Fadrilan Camacho. This has been your panel 1 discussion moderator, Professor Galen Manalang Jr. Thank you very much for the honor of being with you today, and I wish everybody well.
Thank you so much.
Thank you very much, Professor Manalang, and to our speakers, maraming salamat po. We would also like to express our sincerest gratitude to all our speakers today. Of course, we have Dean and Center Director Vicente Y. Belisario Jr., Dr. Mushtaq Ahmed Memon of UNEP Regional Office for Asia and the Pacific, Dr. Maria Rosario Singh Verhare of the Philippine Department of Health, Attorney Glinda Batan-Baterina of Clean Air Asia, and last but not the least, Mr. Ramon San Pascual of Healthcare Without Harm Asia. So it has been a fruitful morning for everyone. Just a reminder that again, we value your feedback, so please accomplish the evaluation form. The link will be shared by our staff and will also be emailed to all of you immediately after the event. You are allowed to accomplish the form until 3 p.m. today. For those who are joining through Zoom or also watching our live stream, to receive the certificate of attendance, please ensure that you accomplish the forms and the post-test. Please note that the links will be shared to you for day 2 and the post-test tomorrow. Okay. Please also take note that the materials presented by our resource persons can be downloaded via a special Google folder, which will be shared at the end of the forum. The folder will be accessible until November 25, 2022. We will see everyone for day 2 of Environmental and Occupational Health Forum tomorrow, November 26, 2021. We will start admitting participants at 8:45 a.m. Thank you very much to everyone for joining us this morning. This has been your Day 1 Master of Ceremonies, Dr. Vivian Bing Fadrilan Camacho. Please stay blessed, healthy, and safe. Thank you.